all the efforts we're doing in our fight against the virus are working. We're expecting to see an increase in the number of cases, but we are saving lives right now. I know that the battle is tough for a lot of people on the economic front. So that's why we announced this morning a new financial aid to small businesses that will be managed by all the different regions. We will also announce this afternoon a compensation for people who earn less than $2,000 a month, the famous $2,000 a month offered by Ottawa. So I repeat our three priorities. Don't go out unless it's necessary. If you do go out, keep your distances, 6 feet, 2 meters. And when you come back home, wash your hands. That's how we'll save hundreds of lives. Thank you all.
Good afternoon. I would like to basically follow up on this question. Ontario has come first with projections. The federal is supposed to do it at some point. What's the importance of you, Mr. Legault, to present projections to the population of Quebec?
I think we have to give the population the information we have. But until now, the information was not clear about the number of cases, the number of deaths that we forecast in the next months or even in the next weeks. So that's why we're trying to have more analysis of the situation. We have scientific people knowing very well how to analyze that are doing that right now. I've got a meeting this afternoon with them. So I want to be sure before giving any figures to the population that it's reliable.
Regarding Mrs. McCann, the Verdun Hospital in Montreal that is quite hit hard by the COVID-19, what about other hospitals in the province? And what's the plan if we start to see major spread of COVID-19 within the hospitals?
Well, the hospitals are prepared. We've been preparing for many weeks. As you know, we've mentioned that we freed almost 7,000 beds and 700 critical care beds. They are free, so to receive the population that would require it. And we've reorganized the hospitals in what we call cold zones and hot zones. So the people who have COVID-19, they are in the hot zones, and there's a staff, a team that is devoted to these patients. So the separation is very clear, very important in the hospitals. But again, situations like that can occur, and in Verdun Hospital, it's under control. They've isolated everybody that has been infected, and the staff that has been in contact are being tested, isolated and tested. But of course, we want to take all the precautions, and the hospitals, they have all the protocols, take all the precautions to avoid these kinds of situations.
Next question, Samuel Pouliot, CTV News.
Hi. Mr. Legault, there's growing concern that the Sûreté du Québec plans to use cell GPS to enforce quarantine. If this happens, how can you ensure Quebecers that their privacy rights will be respected?
Okay. It's true that the Sûreté du Québec is studying the use of GPS, but we haven't used a GPS so far, and we don't plan short-term to use GPS. So if we decide eventually to use GPS, I want to make sure that we have answers about the protection of personal data.
Okay, and yesterday you said that if families want to take seniors out of seniors' homes, it would be a case-by-case decision. Who makes that decision, and what's the concrete recommendation about that? Should they leave their residences, or Will they be allowed to leave?
Okay. But again, the management of the place will have to decide if it puts anybody at risk. So the way the question was asked yesterday, they said the person have to have a certain autonomy in order to go out herself or himself out of the place, and then embark in a car and go home. But we have to be careful. There's no question about permitting the family to get into those places.
Time now for questions sent by email. The first one is from Raquel Fletcher, Global News. Before sending the army to northern Quebec, should everyone be tested before deploying to make sure they aren't bringing the virus with them?
Okay, first it's important to mention that those rangers, they are not deployed, they are already on the North Coast. So right now, those people, they don't have any symptoms. They are already there, so we think it makes sense to use them.
As a second question, there are more and more calls for increased testing for healthcare workers, both in public and private sector. Will you change testing protocols so that all health workers who have come into contact with an infected person, whether they show symptoms of the virus or not, be tested?
They are already tested. People who have come into contact with people with COVID-19, the workers are being tested. These are in our new priorities that we've talked about yesterday. So the workers are a top priority in testing.
Okay, so our last questions are from Philippe Autier, Montreal Gazette. Question for Mr. Legault and Mr. McCann. Yesterday, Mrs. McCann. Yesterday, Mr. Legault, you said you could understand some families want to move their mother or father who is in good health from a senior's residence to their home for the duration of crisis. You said, il ne faut pas fermer la porte. Madame McCann said, on se penche là-dessus actuellement. Have you made any further arrangement for this to happen?
Yes, the orientation is clear. The family wants to take the person back in their home. Certainly will be able to do it on the condition, yes, be it in a long-term facility or in residence, private residence, under certain conditions. The Prime Minister has mentioned that the person can go down to the door and people will help her or him with their belongings, and the family comes to the door and picks up the person, so there'll be no contact with the rest of the residents. So this is clear. People will be able to, by arrangement, will be able to go and get the family member. Yeah.
You understood families.
Sorry?
You heard families.
Yes, of course. Yes, and we did this very quickly because we're very sensitive, as the Prime Minister said yesterday. We're all very sensitive to this situation, and of course, under good protection, it's best for the family member. And if the family wants to do that, take care of their own family member, they'll be able to do it with the proper protection. So we did that. We discussed it very quickly yesterday, and we decided this is the way to go.
Mr. Legault, you want to add something? That's
Nothing.
okay. Okay, so last question for Mr. Arruda regarding the growing outbreak in Montreal. What new steps are you taking to protect citizens?
Well, in fact, it's clear that all steps are taken. The one is, I would say, changing on the testing type of persons going to be tested because and continuing to do, I would say, case and investigations around the cases and contacts. There is still that work very done. It's emphasizing the respects of the rules that the Prime Minister says. No people gathering and everything like that. A more coercive approach. Before we want to convince, now we are constrained if needed. And I would say there is also some advise us to try to don't travel into those regions if it's not essential, if it's not for work. So that's the case, and we'll also look at the island of Montreal, but I would say all around the 450 region around, which are in strict relationship with Montreal. Most of those approaches that have been taken in Montreal are going to be taken, I would say, in the Couronne Nord, from, I would say, probably Lanaudière, Laurentide, and Outaouais, and in the south. So I think probably the advice is given in Montreal will also be said in Laval and those areas, because it's really a hot spot, I would say, so with some bigger, higher temperature in certain zones. But this region, people must be careful in traveling and respect all the three messages that the Prime Minister says each time.
Well, thank you very much. Merci à vous trois. Ceux qui ont un congé, profitez-en bien et bonne fin de journée.